Hello, everybody. Andrea Twarowski here again with Dentalelle Tutoring. Now, let's talk about what if a patient says to you, what toothpaste should I be using? If you're new, you might be thinking, well, I don't know. I haven't seen you before. This is my first time seeing you. I haven't had a chance to look through your chart yet. Why are you asking me? I don't know. Oh my gosh. Well, that is actually a very simple, question to answer. So what I tell pretty much everybody is you can use any type of toothpaste you want, but it depends if you need anything more with it. So let's say the patient has cold, sensitive teeth. Then a Sensodyne makes the most sense because it is for cold, sensitive teeth. Or let's say you notice the patient has thin enamel, or the patient has said to you they like to drink a lot of, tea, coffee, wine. They might say they have lemon water every single day. Then their enamel tends to have things that are quite acidic. So to help with things that are pretty acidic, they need that pro-enamel toothpaste. And always with toothpaste, I do tell the patients, brush every morning and every single night, because your toothpaste is there for a reason, okay? It is there to help you. Your teeth need help because they're always, eating, they're drinking, there's always something to actually harm them. So that toothpaste does help. There will be those patients out there who say, well, I don't like toothpaste, so I use baking soda and water. That's not something that I suggest, simply because a baking soda is quite abrasive, it's quite coarse, and it's not meant to be on your enamel. There is always a little bit of baking soda in toothpaste because it does help to add, or it does help to create that sort of that paste consistency. But it's not meant to be like baking soda and water like on your teeth. It's just simply not meant to do that. But you will have those who say, well, I'm not going to use anything else. I like using things that are all natural, but honestly, that's not helping them. It's just simply not helping them. If they are okay, if they have like no plaque, no tartar, if they never have a cavity, if there's no root exposure, then okay, sure, they can use that, but that doesn't happen. Even I have issues, like if I use baking soda and water, that would harm my teeth, and then I would start to have issues over time, especially. Now, it's not your place though to tell people, that natural toothpaste is just, horrible, you shouldn't be using it, but always sort of pick a way around it so you sound nice, but you also sound professional to let them know. When I have patients say to me that they do use a natural toothpaste, like if their teeth honestly look okay, then I will say to them, your teeth look, excellent. Keep it up with the natural toothpaste. They tend to be a little more coarse because they do add more baking soda to them. So we will keep our eye out for thinning enamel. If that happens, I'll be sure to let you know. I also say if the teeth become more sensitive, please let us know because that could happen. And with the natural toothpaste though, I do always say, because there's the natural toothpaste out there that add fluoride, and some do and some do not, but they should always have that, okay? Because there are some people out there who don't mind if they have it or not, but they want a natural toothpaste. But then on the opposite side of things, you will have those people who say, well, I want it to be completely natural, so why would I add that to my toothpaste? But that actually helps, okay? It does help to prevent cavities, which is obviously important, because we all eat things we should not be eating. Everything these days has sugar in it, so you need that to help to fight off those, foods and things that we're eating. But some people insist, and they say, well, I want things to be all natural, so I'm not going to add that to my toothpaste. Thanks, but no thanks. Okay, well, that's fine. Just always let them know. You know, you have to let them know. Say, well, you should be adding it because of, you know, this, this, and this. It will actually help to protect enamel. It will help to prevent against cavities. If you don't have it, it just makes it a lot harder to fight that off. If they're not eating a lot of sugar, then okay, then they probably don't need it. But even I eat things that have a lot of sugar in it. I have sugar in my coffee every morning. So that is something that I know that I need. So are natural toothpaste bad? No, but I find 99.9% of the population should be using something else, only because it doesn't have the added, you know, anti-gingivitis, anti this, anti that. Just a well-rounded toothpaste has everything that your mouth needs. Now, I like things to be all natural. Absolutely. Like I have makeup that is all natural. My deodorant is all natural. There's no aluminum. I have, what else? I try to eat as clean as possible, but I do like my sugar. I like my, you know, chips and things like that. But if I'm able to choose, then I do pick all natural. But when it comes to my toothpaste, I want a well-rounded toothpaste. And it's a personal opinion, I do not like all natural toothpaste. And I'll kind of tell you why. This is sort of going off topic a little bit. And again, this is just my own personal opinion. I started using an all-natural toothpaste with fluoride in it two years ago, maybe, yeah, I'd say about 2 years ago. And sure enough, when I had my next cleaning and checkup with x-rays, my dentist said, you have a cavity. I've never had one. I mean, I had one when I was 15. So a long time ago, it was a small occlusal. And she said, you have a cavity. I said, what? No, I don't. No, I don't. Like I brush 3 times a day. I floss every day. Like honestly. And she said, yeah, you have a 4-6 DO, and that's a big one. I said, what? You're joking? And she's like, no, we need to fix this as soon as possible because it's going to get larger. I was like, oh my God. And I had not been doing anything different, but I did switch to an all-natural toothpaste. So since then, I will not use an all-natural toothpaste. But, you know, I'm not saying the toothpaste caused the cavity. I'm not saying that if I used a different toothpaste, I wouldn't have had that, but it's an interesting coincidence, isn't it? So I just do not use an all-natural toothpaste anymore. I stick to the normal. I use Pro Enamel toothpaste simply because my fiance Tom, his teeth tend to be pretty cold sensitive because he wears a night guard every night, so he's, you know, he's doing a lot of that. So we use Pro Enamel, but sometimes we have Crest, we have Colgate, but I will not use an all-natural toothpaste. But that's honestly, you guys, that's my personal opinion. I do not tell people not to use it, but I do let them know. The other toothpaste simply have more in it that I feel we all need that little bit of, you know, extra added stuff to it. So, okay guys, so I hope that helps with the toothpaste question. If I didn't answer something though, please let me know and then I would be happy to answer it. I will see you guys in the next video.